This is Dr. Megan, the Prednisone Pharmacist, and people often wonder, can I safely take prednisone if I'm pregnant? So the reason I'm answering that today is because I am pregnant. If I were prescribed prednisone, I would probably use it if a lot of certain things were in place. First of all, prednisone is always prescribed when we weigh the benefits and the risks. And if the benefits of controlling a life-threatening condition or a really severe autoimmune condition outweigh the risks, then it's worth taking. So what are the risks? When it comes to prednisone and pregnancy, there aren't necessarily a lot of risks. We know for sure that it can be safely used at the end of a pregnancy, especially when somebody's at risk for delivering a baby early. It can help to have the baby's lungs be ready to breathe if that baby's going to be born early. Then what about weird pregnancy complications like cleft lip or cleft palate? There's really conflicting evidence about this, about whether or not the cleft lip could be due to the prednisone or not, because it can only happen within weeks 5 through 6 of pregnancy, right at the very beginning when you first get that positive pregnancy test. You'd have to be taking the prednisone. And so were you actually taking prednisone at that moment or not? And if it wasn't at that moment, then it's probably okay. You're not going to get cleft lip or cleft palate. Then what about preeclampsia or preterm birth or low birth weight? There's been studies showing both ways that prednisone could cause those, or maybe it won't. But again, the evidence is really weak, and it's probably not. It probably doesn't cause any of those problems. It's probably safe for those reasons. What about gestational diabetes? That is, prednisone itself causes diabetes, so does it cause gestational diabetes? Again, the evidence is just really unclear. So essentially what I'm trying to say is, if prednisone is the safest option for you, if it's more dangerous for you to be taking an alternative treatment, like for example, if your doctor wanted to give you methotrexate and you decided you want to get pregnant, methotrexate is much more risky than prednisone. And so I would take prednisone over methotrexate any day if my body needed the prednisone. So I want you to know that the evidence so far, over almost 70 years of data, doesn't show that prednisone itself increases the risk for any pregnancy complications. Signing off as Dr. Megan, your Prednisone Pharmacist.